I see we're at 12 o'clock now. So what I'd like to do is go ahead and kick us off. So welcome everyone to the Crisis Jam Learning Community. My name is Dr. Aisha Delaney-Brumsey, but obviously just call me Aisha throughout this. I'm the director of the Behavioral Health Division at the Council of State Government's Justice Center. I'm so very, very excited to be hosting this today. I'm a frequent participant and a one-time speaker on this, so really excited to be with you all here today. We're going to have our featured presentation later on from NAMI talking about their week of action. We'll have Hannah and Stephanie from NAMI doing that. Really excited to have them up. And then next slide, please. So this is really just as for all of you who've been here, this is who is in the room. And for those of you who are new, you can see it's really an impressive set of folks who come to these meetings. All 50 states are represented, 60 different organizations. If you are representing an organization, you do not see them, your organization listed here, please let us know, let the Crisis Jam organizers know so we can make sure to add you to this. And if you see an organization that should be on here, and isn't, please also extend the invite to them. We'd love to continue to build the people who benefit from this really rich learning community that has been benefiting all of us for a long time. So next slide, please. So as you all know, if you want to get information on this, you can always go to the Crisis Talk, the talk.crisisnow.com website. You can always get the Zoom link and the materials from presentations, as well as past videos on this website. Next slide. And you can also see all of the recent highlights, articles, quotes, everything that you get here also on that webpage. And so a great way to go back and make sure you're able to review the materials. And also for folks who couldn't join, also they're able to see this information there as well. So that's at talk.crisisnow.com. Next. So what I'd like to do today is really set the stage for the conversation that we're having by talking about this quote from the Arizona Medicaid, from Jamie Snyder with Arizona Medicaid. And I'm not seeing the quote come up right now. Great, thank you so much. So it's a bit of a long quote, but I actually think it's really helpful to hear the whole thing. So AHCCS has a long history of developing solutions that meet the needs of underserved communities. As an example, AHCCS allows for reimbursement of helicopter and equine transport under its non-emergency medical transport benefit, allowing members of the Havasupai tribe living at the bottom of the Grand Canyon to readily access healthcare services at facilities and providers in proximity to the rim of the canyon. I probably didn't quite hit the pronunciation of that tribe's name, but what I think is really important about this quote, and it's a concept that is part of what drives me in the work around improving crisis systems, is that this is an example of a system, government system, working to meet the needs of some of the most marginalized and underserved communities. And what I believe is that when you build that kind of, when you build systems that respond to the needs of the people who have previously not been responded to, that system works well for everybody. And so I'm also getting the note that I'm messing up Arizona's Medicaid, so access, which makes a ton of sense. And I feel like, of course I know that because I've definitely done my visits to Arizona to see how their crisis system works, but so you'll have to excuse me all. But that's really what I think is important about this quote and why I'm excited as a way to start this Crisis Jam with them. So if you could go to the next slide. I'd like to now bring up our featured speakers from NAMI and for Hannah and Stephanie to talk through the Reimagine Week of Action. Hannah and Stephanie, are you on and ready?
Yes, yes, we are. Thank you so much.
Absolutely, thank you. Passing it to you.
Wonderful, and we can actually move on to the next slide. So I'm Hannah Wazalowski. I'm Director of Field at NAMI, and I am joined by Stephanie Pasternak, who is our Senior Manager State Affairs. And we are so happy to be here today to talk a little bit about Reimagine, a week of action to reimagine our national response to people in crisis. This is really an initiative to bring attention to the work that everyone on this call is doing to change our crisis system. In conversations with partners, we really realized there was a need to build momentum for the policy asks to support a crisis system at both the federal level, as well as help states prepare for legislative and policy changes needed at the state level. And so this has come together very quickly, and you know, we keep getting a question, why now? Could we do this next year? There's so much happening at the moment, and yes, it would be great to have a little bit more time to do even more, but we felt it was really critical to bring folks together now. And we're so grateful for so many within the crisis community for signing on as partners or joining us as speakers in this effort. With so many things moving at the federal level, it's really important for us to bring together partners and bring everyone who's impacted by a crisis system to the table. And the quicker we can do that, the better. And we also realize that state legislative sessions start very, very soon. And we wanted to use this as an opportunity to build momentum at the state level and give state stakeholders the tools, resources, and information they needed to be successful and really arm them to advance crisis efforts at the state level. So we can go to the next slide, please. Our major goal here with the week of action is really to build momentum around efforts to respond to mental health and suicidal crises across the country. We know that no organization can do this alone. We know that the mental health and suicide prevention community can't do this alone. We know that we are going to need to bring everyone that is affected by our current crisis system to the table to make sure is a system that is responsive to everyone's needs, but also to make sure that we have the power of all of these voices behind this effort. This is an incredibly unique opportunity we have to really change the paradigm around crisis response. And we thought this was a perfect opportunity to bring more organizations and advocates into the fold. So we are really using this week of action to engage and educate new partners about what a reimagined crisis system looks like and what it means for different communities. And we'll talk about in a minute, we're talking about the intersectionality of crisis care in different populations. We also want to highlight personal stories. As NAMI, that's obviously a big priority for us, but we want to make sure that we are working to build a system that is responsive to the needs of the individual it's meant to serve. So we want to highlight those stories to help us get policymaker attention, as well as media and public interest in 988. We really see the tides turn on major policy issues when there's a public push for change. And so we really think that it's our job as a mental health and suicide prevention community to get the rest of our communities on board and pushing policymakers to do the right thing. So we think this is a great opportunity to get some more momentum behind this and get more attention around this issue, because we all know on this call that a crisis can happen to any one of us at any time. And so we want people to have a stake in building a system that is going to be there and responsive if they or their loved one need it. We also are doing a special advocacy training intensive for state leaders who are working on 988. Where we're really digging into more complex policy issues around 988 implementation and crisis services implementation, as well as tactics on how to advance a key policy priority. And then finally, with so many partners on board, we really think this is an important opportunity to engage on our federal priorities. As many of you know, the updates on this call every week, we have a continuing resolution on the current budget before a fiscal year 2022 budget is passed. That expires on December 3rd. So the timing for this, which is November 15th through 19th, is really important because it'll allow us to make a lot of noise about the need to invest in crisis services in the federal budget and what Congress can do to help build crisis services around the country. We can go to the next slide, please. And so this is a list of our current partners, and I will note that we have added a few since we sent in these slides. So the ACLU, the ARC, Police Treatment and Community Collaborative, and the National Association of Social Workers have also joined on. But again, this is to show that we really wanted to create a broad partnership of organizations active on the advocacy front to push this issue forward at both the federal and state levels. Again, so many of you are on this call, so thank you. We appreciate you joining us in this effort. We wanted to show with this partnership community that, again, there are a lot of people with a stake in crisis services being successful. And it's not just those of us who have been there all along. A lot of people are learning about this and want to be involved and want to have a seat at the table. And so we think this is an excellent opportunity to bring them in, educate their membership, and get them out there as advocates on these issues. If you can go to the next slide, please. So let me tell you a little bit more about what's happening during the week of action. So again, it's November 15th through 19th, but really it centers around key events happening on November 16th, 17th, and 18th. First, we're going to have those fireside chats, which are those personal stories and conversations with peers and families that have lived experience with our current crisis system. We want to make sure that those are used to help inform how we go about additional efforts to build our crisis system, and that everything that we do is infused with the peer and family perspective. We also want to dig into the problem. And as I mentioned before, bringing in so many new partners, this really gives us an opportunity to explore the intersectionality of crisis care in different communities. So we'll have discussions around crisis response and racial inequities, the unique needs of youth and young adults in crisis, as well as the emergency response system's perspective on our current crisis system and what impact it has on other emergency systems in our communities. And then finally, that advocacy intensive that I mentioned is really to dig deeper for those who want to get a little bit more into the weeds, to better understand what different states are doing right now, what's been successful, what's been a challenge, and really to learn more about implementation and advocacy around 988. And then all week long, we will be pushing out asks on some of those federal priorities, like S1902, the Behavioral Health Crisis Services Expansion Act, and fiscal year 2022 appropriations. So there's a lot of opportunity. And again, this is all to raise noise around 988 and make sure we're getting as much attention around a new crisis system as possible. So I'm going to pause there and turn it over to my colleague, Stephanie. Steph?
Yeah, thanks, Hannah. So I'm Steph Pasternak. I'm Senior Manager of State Affairs at NAMI's National Office. And I want to dive in a little bit more to some highlights from the agenda. If we could go to the next slide. So for some of our general sessions, as Hannah mentioned, we're going to have panels on how 988 intersects with some key perspectives, such as crisis response and racial equity. Also a panel on supporting youth and young adults in crisis, and what happens if we don't act, a conversation with emergency first responders, so law enforcement, EMTs, and more. We'll also have several fireside chats. So people and family members who have navigated the crisis service system as it stands today. And also policymakers pushing for change. We will have a State Representative Orwell from Washington State speaking at that session. I know she is often on these calls and we're excited to have her. We'll also have some deep dive sessions, really a learning opportunity for attendees, such as what does an ideal crisis system look like? And Dr. Margie Balfour will be speaking to that. And we'll also have a session I want to highlight is what the public expects when it comes to crisis response. We have actually done some public opinion polling on what folks want to see if they themselves or a family member were to be in crisis, who they would want to respond, what they would want that response to look like. And we're excited to share the results of that polling during that session. And then we'll wrap up with kind of where efforts are to reimagine crisis today, where things stand federally at the state and at the state level, and what really needs to happen next in the short term and the long term. And if we can go to the next slide, please. And so as Hannah mentioned, we also have part of the day will be an advocacy intensive. So these sessions are really geared towards folks that are very actively engaged in 988 advocacy in some way. And the intent behind these sessions are really to give attendees sort of the skills and the substance they need to really dive into 988 advocacy. So for kind of the policy knowledge and substance sections, we've got sessions on user fees and why they're important and how you push for those. How the National Suicide Prevention Lifeline works and how we think it'll work with 988 and how kind of what does it cost, how states can go about projecting costs related to 988. And then we also have sessions really about the skills and tools advocates need to be successful. So building and expanding an inclusive crisis coalition. How do you get media and policy maker attention for your issue? And many more sessions kind of along those lines. And if we can go to the next slide. Another big component of the week of action is our advocate mobilization. So during the week of action, we are going to be asking attendees to contact their members of Congress about key federal asks related to 988, including many focused on the FY 2022 budget. So we'll be asking just some examples of the priorities that'll be highlighted in those activations are 10% crisis services set aside in the mental health block grant. Right now that set aside is only at 5%, is also not permanent. And so we think Congress should dedicate no less than 10% of a set aside for crisis services. And also 113 million for the National Suicide Prevention Lifeline. So that they can provide, so that there's timely help for anyone who calls in distress. And within that, we'll also be asking for 7.2 million to provide specialized response for LGBTQ youth who are at risk. $100 million for a mobile crisis team program to help communities develop mobile crisis teams, which we know are an invaluable core component of an effective crisis response. 10 million for a behavioral health crisis coordinating office within HHS to really bring all the federal agencies involved in crisis response together to have a clear and comprehensive response. Also, we're either as a standalone or as part of any kind of broad mental health package that might be introduced early next year. We know the Senate Finance Committee is looking at doing something similar to that. One of the key pieces of legislation that we want to see move is S1902, which is the Behavioral Health Crisis Services Expansion Act, which really does two key things, sets national standards for crisis services, and importantly requires all federally regulated health plans to cover mobile crisis team services and cover crisis stabilization services. And I'll just note that for the appropriations numbers, these all reflect the House passed budget. So there's a little bit of a difference with some of the Senate numbers.
Hi.
I will also just note with though a lot of our activations are very federally focused, we're definitely encouraging folks to think about how they can leverage this week of action for the state level as well, including, writing letters to the editors, conducting town halls with key state stakeholders, doing media interviews, social media posts, and much more. And now we can go to hop to the next slide, please. So just a reminder to register if you have not already done so. It is completely free. Just remember, we have 2 registration options. There is a general admission option where most folks are going to sign up, but there is also an advocacy leaders option. So if you're someone who's leading or engaging in 988 advocacy, or you are very interested in doing so, you should actually register under that option. And I'll also note on our registration page, we are quickly filling out more information about these sessions, about the agenda. So more information is available there. And if you have any questions about the event itself, please contact us at reimaginecrisis@nami.org. And next slide, please. And finally, just want to emphasize that we don't envision this collaboration, ending with the week of action. We are so grateful and excited that so many different organizations have rallied around this. And so we want to bring this group of partners together in an ongoing fashion to keep helping state leaders gain visibility and advance their efforts to push for federal action via resources and more visibility, and also to serve as a resource for 988 implementation efforts. And with that, that's kind of our big overview with our week of action coming up very quickly. Hannah and I are happy to answer any questions that folks have about the event. And I know we have several partners on the call. If anyone from our partner organizations wants to chime in and add a little bit more, please feel free to.
I just want to jump in and say a big thank you, Hannah, Stephanie, for that overview. And I'm just watching the chat also. There's definitely some great feedback that's going on. And I also want to just validate what you said, is how impressive it is that the set of organization you've pulled together for this. I think that's a reflection both of the level of interest in this, but also the strength of the advocacy that you're pulling together, that you've been able to pull together this kind of diverse set of partners, and that you're also thinking about a range of ways in which you're going to be supporting that advocacy, both from having people, the families and peers to do this work, and also focusing specifically on particular groups of people who need to be really supported in this. So that's fantastic. And I'm hoping, I think we will probably have some time for the questions in the chat, but first what I want to do is bring up Wayne Lindstrom to just provide his reflections on what he just heard. Wayne, are you here with us?
Yes, I am. Thank you. Good to be with you this morning. I think this is a great mobilization effort that builds on this whole 988 implementation initiative. I'm an old guy who's been around a long time, and this is the 50th year of my career in behavioral health. And in a discussion I had the other day, we were talking about, well, what else memorable like this has happened in the last 50 years? I thought of the Community Mental Health Act back in 1963 and the whole deinstitutionalization effort. And this is a once in a lifetime opportunity for us to have robust behavioral health crisis response systems in every county in this country. And I really appreciate NAMI taking the lead around further building on this momentum, because we're getting very close to July of 2022. It's just around the corner. There's a tremendous amount of work to be done. There's a lot of legislative initiatives necessary at the state level, et cetera. So kudos to NAMI, and we're very appreciative at RI in terms of being a partner on this initiative. So thank you again.
Thank you so much, Wayne. I'm also seeing a question in the chat, Stephanie or Hannah, I'm not sure if you can speak to this, from seeing Leslie asking about how Senate 1902 is being linked to federal parity efforts. Do you have any information on that?
Well, I mean, I think this is, kind of an effort to reduce discrimination against mental health and substance use care, and that standard of care for crisis and so many other health conditions is covered, but we often see so many elements of a crisis continuum of care that are not covered by insurers. So while this will not apply to all plans, it will apply to most plans because ACA marketplace plans and employer-sponsored coverage are included in what this would apply to. So we think that this is a huge step forward in ensuring that equity and coverage. So, you know, it's a work in progress, but, you know, there's a lot of momentum that is building on S1902 and HR 5611, which is the House companion that just was introduced. So that'll be an important effort to make sure that mental health crises are treated like other healthcare crises.
Great, thank you. And then I'm also just flagging here that Marcy has also flagged in the chat. In Kentucky, we don't have a bill drafted or bill sponsor confirmed, and just asking, does anyone have any example of a coalition letter that may be signed onto without that specific aspect, but with the overall goals, and an ask to share that. So I'm just elevating that for the everyone in the room. If you do have examples, please do share. But Hannah, Stephanie, if you have anything you'd like to respond to that, also I can leave you some space for that. All right, and just so everyone, just as a reminder, the slides for the featured presentation will be available on the website, so you can always go back. But I'm also hearing, and then Stephanie saying, please do reach out with any questions and any information. So I want to thank you both for all of that. Oh, another question, can you just, from Margie, just remind us all what the House companion bill number is?
HR 5611. Oh, somebody beat me to it. Introduced. It's the same language. Also the Behavioral Health Crisis Services Expansion Act. So for co-sponsors in both the Senate and the House versions.
Right. And any other, I'm realizing I didn't want to move us along too quickly to just make sure, see if there's anyone who is in the chat or who would like to come on to ask another question of Hannah and Stephanie. We have a little bit of time if so. You're also free to just take yourself off mute and talk.
One of the things that might come up, Aisha, is there an opportunity for people to potentially suggest other dialogue that could happen during these sessions now? And if so, who would they send those ideas to?
Great question.
That's a great question. Yes, I mean, this is still all coming together. We have a lot of speakers that we've confirmed. There are still some opportunities, but we're also, during our advocacy intensive, going to have what we're calling networking roundtables that will be around different distinct topics. So we would love to hear if there is a topic you want to discuss with other state leaders, and, you know, things like, you know, my state isn't going to implement a user fee. What can we do to help fund these crisis services? Or my mind is going blank on some other ones, but we can add more topics. We have over 500 folks who for that advocacy intensive, and these are going to be small roundtables. So we would definitely recommend reaching out if you have something you want to bring other folks together and see what people are doing across the country. We can definitely add those in. But again, as Stephanie said, we hope this isn't a one and done. We see a need for additional deep dive sessions for advocacy leaders across the community to dig into more implementation topics and advocacy topics around 988 and crisis services. So we welcome all ideas, and if we can't fit it in here, we know there's so much more to cover, and we're looking for other ways to do that.
Great, thank you. And Hannah, Stephanie, you mentioned this just a little bit earlier, but I want to make sure folks have this information. I see Becky also asked about it. If other partners want to sign on, how do they do so? Are they reaching out to you directly? What's the best way?
Yeah, it's best to reach out to me, and I can let you know what we're asking of partners. We are trying to wrap that up so we can finalize everything for the week of action, but reach out to me. I did drop my email into the chat, and I'm happy to share the partner overview and what our expectations are for partners. So thank you.
Fantastic. And I see just a couple more coming in, but just for the interest of time, I do want to move us on. But Hannah, Stephanie, if you don't mind, you're free to be in the chat and to respond to questions as they come up. And I also know you've, as I said before, generously offered to answer any questions over email. So just thank you again so much for this overview, and also just for the work that you're doing to support the implementation of 988 and also the expansion of effective crisis services and the support of our federal partners in this as well. So thank you so much for your work here. All right, so I'd like to transition us to the next section. And I would like to bring up Jordan Gully from TAC, who's going to be talking about a framework for state and local plannings, local systems planning around 988 and the report that you just published. Jordan, can I turn to you?
Yeah, thank you so much for having me. Obviously, everyone on this call knows how important 988 planning is, and as it offers a unique opportunity for behavioral health systems, 911 systems, law enforcement, and other stakeholders to come together and strengthen behavioral health response. So the Technical Assistance Collaborative just published a Pew-supported 988 implementation guide that focuses on assisting state and local leadership in planning, implementing, and sustaining an effective crisis calls system. And we know planning is a complex endeavor, and obviously based on involvement in these sessions, states are in various stages in the planning process. So we wanted to create kind of a comprehensive guide for reference. So it offers 8 high-level planning areas, such as interoperability with 911, sustainable financing, system evaluation, looking at design issues to consider, scenarios that states can anticipate that they might encounter, and then things that they might have to troubleshoot for. And obviously, this is all giving overarching consideration to increase call volume and helping states plan to ensure that there's availability of mobile teams and upstream services, so that states can ensure, 988 serves as the gateway for access to broader behavioral health crisis systems as needed. So I'm not going to take up a lot of time and cover a lot of the content because you all can read about it, but I will drop the link in the chat so that you can have access to this report.
Thanks so much, Jordan. And when you drop that link in, or I guess I'm going to put you on the spot here, but would you also be willing to share your email in case people have questions or thoughts about that or some other content?
Oh, absolutely. I will put that in the chat as well.
And then, of course, if people have questions right now, feel free to respond on the chat as well. But I just want to say that this sounds like a great resource that's coming out now. And I think I noticed in the chat some questions about what are the policies and practices people have to implement to be prepared for some of these crisis system innovations. And it sounds like you've really put together a guide that not only thinks about what are some of the challenges states are going to come up against, but also some of the perennial questions you get: financing, sustainability, that interoperability piece. So this sounds like this is going to be a really great resource for people who are at, it sounds like, any stage in their planning process here. So thank you for that.
Yeah, absolutely. That is our hope for sure.
Great. Fantastic. So I'm now just going to talk through a little bit about some of recent news around crisis system innovations. And these are 2 pieces of news that have been, that are on the Pew website. The first really is focusing on what many of you in the room already know, or maybe all of us in the room already know and are experiencing in our local systems, but that 911 call centers are not yet equipped, are not well equipped to handle behavioral health crises, whether that means they don't have staff who are trained, that they don't, and that even if they are tracking data on these types of calls, that's not really reported publicly or internally. I know when we did a study, a very informal survey and study looking at the number of calls to 911 in some of our law enforcement learning communities that were about behavioral health crises. And these are very advanced communities that have been doing work at the intersection of behavioral health and law enforcement. They all had different definitions of what a behavioral health crisis call was. And so it made it really challenging to even know within each system and across these systems, how many of the calls are going to 911 that are for behavioral health crisis. And then in a lot of communities, there are really limited options to dispatch. So this is just one example of a really useful news report that's been coming out. The next that is out right now, the next slide is really focusing on the fact, or the news articles, that many states have not yet acted to support the 988 behavioral health lifeline, which is why it's so important that all of you are here today and thinking about how to elevate the support in your states, and certainly also the work that NAMI and many of the other organizations are doing to advocate for that. The other thing that I just wanted to flag is, I've been doing this work for a while. Many of you have been doing it for even longer than me. And what we're starting to see now around crisis system interventions is a recognition within the media that this is a challenge and a real focus on the problem statement. And that's an important part and an important phase of reform, is that that people across the country are aware that this is a challenge. But I also know from the work that all of you are doing that we're not just in the phase where we're really kind of admiring the problem. We're also in the phase where we are implementing solutions, and that's what's exciting about this work. So take a look at these news reports, pass them on to folks in your network as well. All right, next slide. Okay, so I am going to poorly fill the role of Stephanie Hepburn, who is not able to join us today, and to talk about the most recent publication on the Crisis Talk blog, which is with Annie Murphy, who's the coordinator of the Kansas Suicide Prevention Hotline. Annie Murdoch, I apologize. And so Annie, you are the coordinator for the Kansas Suicide Prevention headquarters, the Core Chat program. And you spoke to Stephanie about what that program is and why it's important, particularly so that you can, so that people who might not typically access crisis services are able to access it. Could you just give us a few moments or a few sentences on what this Crisis Chat program is?
Well, the easiest thing is to say that it kind of goes a little bit beyond the phone counseling that we provide when people call in on the 800 number. It's basically the same type of service, except that it's through instant messaging, online chat, as well as text. Back in June, we actually now take text chatters that call in and or connect with us. And I would like to say that what I have been both a phone counselor and the chat counselor, and being on chat, I feel that we're reaching so many more people than we would on the phones, especially to the younger population and to the teens. We have so many teens that come on board that, well, a lot of them they say, I have social anxiety, I can't reach out, I can't call. And especially during the pandemic, there was so many people that were reaching out to us in a lot of crisis. And it was a lot, largely due to the fact that they were all cooped up with their family members and they had no way, to really reach out. Calling them on phone it's just not, they don't have the, the privacy to do that. So a lot of them are reaching out through text, through chat. And so it's it's incredible how valuable it is.
Mm-hmm, mm-hmm. Yeah, I was impressed with the way this really helps, particularly younger people feel comfortable with accessing that immediate crisis support. I also thought you did a really nice job in the article of talking about the support that you provide to your staff who are doing a really challenging job. So I was wondering if you could just touch on that very briefly.
Yeah, I would say to me, that's like the main focus that I feel is so important, because it's like the analogy with in the airplane where, the oxygen masks drop and they always tell you, if you're a parent or whatever, put it on yourself and then assist your child, because you have to be there, to be able to help them. And that's the whole idea around the counselors. It's like they really need to be supported well, or they're not going to be able to support the people that are, that they're trying to reach. And I think it really is helping with retention as well, because a lot of the counselors that we, the pool that we draw from is from the university. and they're dealing with a lot of stuff on their own in their own private lives with going to school and well, you all remember what it was like being in college, I think. So it's stressful. It's a stressful time. And then to have on their plate to be dealing with, you know, crisis chats and having to deal with calming those people down and assessing for risk when it could even be giving, you know, causing triggers for them, because a lot of them have lived experience, or they come to it, maybe they don't have lived experience, but they have family members or friends. And so there's, it's just, yeah, it's very intense. I think I mentioned that if you do like a 4-hour shift, you will feel drained. It'll feel like you've been, you know, 8 hours. So it's very, very important to support the counselors. And that's where I've really been trying to focus on.
That is really, I think that's an incredibly important way, piece of the work that you're doing, and thinking about how to make sure that the folks who are really on the front lines of our crisis system have the support that they need. I'm looking at the time. I know we don't have tons of time, but I am seeing kind of two what I think of are related questions. I'd love if you could kind of think about responding to those. I'm going to do a bad moderator thing and ask you 2 questions and ask you to do 1 response. But you hear from Matthew Goldman that I've heard that crisis chat can get flooded following high-profile social media posts about suicide. How do you manage those surges? And then another question from Wayne Lindstrom about please talking about the increased staffing need to do chat or text. So just any focus on kind of how you manage the flow of text and chat and the staffing needs there.
Well, we work in conjunction with NSPL. So they're actually the ones that the Lifeline is the one that is controlling the queue and providing the chats to us. I will say that there's always somebody on. We're not the only ones, you know, handling the chats. Well, let me step back. We handle chats from all over the country. So we're not Kansas specific. Right now, it's all over the country. And so the NSPL has the queue, and there's at least 30 core centers and their support centers that are answering these chats all the time. So my hours that our center works is from 1 to 9 p.m. Central Time. And there's always people in the chat. And I mean, all you can do is just, you know, keep taking one after another. But there are other centers that are hopefully taking up the slack. And I do know that NSPL has some stats. I think that maybe sometimes the people in the queue might wait 10-15 minutes before they actually get connected with a counselor. And of course, they're always, you know, told if it's an emergency or whatever, you can call in and call the 800 number to get immediate service. But okay, what was the other question? Now I forgot. There was
yeah, I think the question was more specific just about what happens after a high-profile suicide post and how you handle that surge. But I think you've kind of touched on that. Yes. Right.
Yeah. We just, of course, you know, we just make our counselors aware that they might be having more intense chats coming in and people coming in that are triggered. And like I said, again, it's providing support. We have supervisors there watching their chat in real time. We can reach out to the counselor and talk to them and help guide them through any of the more difficult chats.
Well, thank you so much, Annie. I appreciate you taking the time. The article is really wonderful. You can see it on the talk.crisisnow.com website. So thank you.
You're welcome. My pleasure.
Next slide, please. So now I believe we have Dr. Richard McKeon here to provide the SamHSA update. So Richard, can I bring you up?
Absolutely.
Great.
So thank you very much. Again, I want to thank everybody who's presented on this call. It's really valuable information. I'm looking forward to going to reimaginecrisis.org and learning more about what's there. That sounds wonderful. And I also wanted to mention, given the presentation about the great chat work coming out of headquarters in Kansas, that a number of months ago, Dr. Madeline Gould published a SamHSA funded evaluation study showing that those able to access the crisis chat service through the Lifeline experience reductions in suicidal ideation. So I would reference that for people's interest. Let me go over a couple of things. I did notice something in the chat saying that 988 doesn't involve chat and text, but I would reframe that. So first off, the FCC is in the process of, and they will be voting this month on their proposed regulation to require texting to 988 on the same timeline as calling 988, in other words, by July 16th, 2022. So that guidance is available on the FCC website of what they are proposing. And at the commissioners meeting this month, they will be voting on that. So it's not finalized until they vote. But we do know this is a major priority of the acting FCC chair, who is also President Biden's nominee to be the permanent FCC chair. So it would be surprising if it was not approved there. So that's important for folks to be aware of. Also, yesterday, the White House released an important document, and Jeff Hill kindly put it in the chat. So that there's information, I think a link to the press release. And this is on a strategy for reducing veteran and military suicide. But when you actually look at the recommendations, a lot of it is far broader, and it does have implications for suicide prevention and crisis services more generally. So I would call people's attention to that. Also, I don't know if anybody from NIMH is on this call, but they have started today the first day of a two-part review of clinical training in suicide prevention, and a really important expert meeting that is going on. And in one of the opening presentations, the presenter discussed what he called the remarkable shortage in practitioners who address suicide. And of course, the more of a problematic that is, the more likely it is that people who are thinking about suicide will end up being seen in the crisis system, to the extent that we don't have people in other parts of our mental health systems who feel competent and able to work with people who are thinking about suicide. So anyway, just wanted to let you know, NIMH was also doing that important meeting. I think on an upcoming crisis chat, we'll be hearing from Melinda Baldwin about some of the work going on that SamHSA convened on children in crisis services. So that is coming up. And been doing a lot of work on the issue of 911, 988 collaboration. It's critically important moving forward. Those of you who are doing work in that space would love to hear from you, find out what you are doing, because there is, I think, a lot of important work that we really need to do moving forward, including to the extent to which we can in advance of the July 22 full implementation date for 988. So I will stop there, but thanks for the opportunity to give an update.
Thank you so much, Richard. I appreciate it. I see some other questions in the chat, but just in the interest of time, I'm going to move on to our next one, but that was all very helpful. Thank you so much. Now I'd like to bring up Dr. Brian Heffern. Brian, can I bring you up to give us the Nashbita update?
Thank you, Aisha. Can you hear me okay? Thank you. So good job, Aisha. Thank you. And thank you for everybody who has participated on the call, and thank you for the people that are listening in. There's a lot of expertise that's out there. I want to thank Richard for all his continued good work in representing SamHSA and SamHSA's energy that they're putting into this effort. The states, the leaders in all the states behavioral health leaders are all focused on 988 and crisis services. And we had a call this morning with Ohio, with Commissioner Lori Chris, and she was talking about the work that they're doing, and they're reaching out to stakeholders throughout the state of Ohio, all of those who would be impacted, and they're doing a fantastic job, not just of working with people in behavioral health, public health, but all the stakeholders who would be impacted. So watch for Ohio. They're really leaders across the country in this effort. Next slide, please. I wanted to highlight these papers. We have over 50 papers starting 2017. We started working on these in 2016. And I wanted to make sure that people knew where to get these papers. These are examples of them. And Megan is putting in the chat where you can click and get them. One of the papers was done by Dr. Gould. It's in our 21 papers, Suicide Prevention and 988 Effectiveness, and the Effectiveness of the National Suicide Prevention Lifeline. Wanted to highlight that because Dr. Gould has been mentioned several times on this call, and she's going to be doing a presentation, I think sometime in the next couple of weeks. So with that, I'll send it back to Aisha. Thank you.
Thanks so much, Brian. I just want to, I know we've all seen these papers, but I want to validate that this is a fantastic set of resources. I use these all the time in my work, and I know that my team does as well. So, thank you for, your leadership on helping to pull that together as well. Okay, next slide. I would like to bring up Jack Roselle for this, our crisis trivia hot seat. I should have some music in the background. Dun, 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 dun. So Jack, this is one we had last week, which was about the PM for crisis capitation rate in Arizona. But your question, next slide. This is a hard one, I think.
All right.
Your question is about a classic policy and research paper. So we all know that SamHSA published just last year in 2020, a really great best practices toolkit around crisis systems. And it outlined the 3 core elements of a crisis system: place to call, someone to come to you when you're in crisis, and a place to go when you're in crisis. This classic paper did the same thing around physical health, accidents, heart attacks, and helped to really revolutionize how we manage and respond to injury in the US and help save millions of lives through this system. And this first sentence here, I just want to draw your attention. Public apathy to the mounting toll from accidents must be transformed into an action program under strong leadership. So that sentence is towards the beginning of this paper. So the question to you, Dr. Roselle, what was the name of this landmark paper and what year was it published?
Oh, wow. That's a doozy, because if it was the other question, I would have tapped on Margie from Arizona, but now I'm a little stumped here. Can I appeal to the audience?
You can absolutely appeal to the audience. You've got your phone a friend, or appeal to the audience. So audience in the chat, anyone want to help out on when this paper was published and what the name of it was? We're also taking guesses on years.
I'm going to see if I get anything good in the comments. And if
I'll
not,
just do the background.
Yeah.
Getting anything? This is a stumper.
Oh, so Dr. Raffaello, oh, wow. Okay. Dr. Raffaello has given us a wonderfully specific answer. Kelly Marshall concurs. Accidental Death and Disability, a 1967 report from the National Academy of Sciences.
All right, I'm going to say that that's a pretty close win, because the name is Accidental Death and Disability, the Neglected Disease of Modern Society, and published in 1966. So I'm going to give that a yes, because that was a tough one. So,
thank you to the audience.
Yes, thank you to the audience. Thank you, Jack. Appreciate it. All right, I know we're running close on time, but I'd like to get through as much more as we can. So next slide, I'd like to bring up Sarah to talk about what you're seeing on the Hill around 988 and crisis systems, and give us a little bit of that national overview. Sarah Corcoran.
Great, thank you, Aisha. And it got quite a few items, so I'll try to go through as quickly as I can. Last week, we saw some reconciliation bill draft language, which is this kind of top bar here on the chart. That included permanency for the CAHOOTS mobile crisis FMAP bump that was included in the American Rescue Package. Also, the Certified Community Behavioral Health Clinic demonstration program that extended it by 2 years and expands it to allow any state in the nation to participate in that Medicaid demonstration program. There's also the provision for allowing Medicaid access for individuals 30 days prior to release from incarceration, which was a great provision that Congress has definitely been working on for a while. It also includes $150 billion for home and community-based services and $75 million for the National Suicide Prevention Lifeline. There are a few other items mentioned in the box, including some parity and maternal mental health provisions. But this is not a final draft by any means, though it is a really great showing for mental health. It looks like there are a couple more negotiation items still in flux, but we're hoping it's coming close to the end here. And you know, we don't expect things to be stripped at this point unless there are some major changes, but we'll keep you posted on that. And then the other item that I wanted to flag that actually Steph and Hannah mentioned earlier, S1902 HR 5611, the Behavioral Health Crisis Services Expansion Act. If you are interested in supporting that bill, I'm going to drop my email in the chat. Please send me an email and I'm happy to send you the bill text and a section by section one pager. We would love organizations to support that bill. I do have a draft document with some talking points if you are interested in you know, sharing that with your member of Congress and urging them to sign on as a co-sponsor. So again, I will put my email in the chat for people. And then the final quick flag, Rep. Cardenas, who is leading the federal parity bill and is one of the co-leads on this HR 5611 bill that I was referencing, is planning to introduce a comprehensive package on 988 implementation that's going to be coordinated with those two bills. So definitely stay tuned for that, but it's some exciting developments on the Hill, and we'll keep you posted as we learn more about reconciliation.
Sarah, thank you so much for that update. That was dense and really useful. And thank you for your work to also coordinate and lead some advocacy in this space. Now I'd like to bring up either Natalie or Taylor or Lauren for the American Foundation for Suicide Prevention to also talk about the national work that they're doing.
Hi, good afternoon. I just want to thank Sarah for her update. And I think that she really gave a really good overview. The only thing I'll flag is that on Friday, Senators Cassidy and Murphy are requesting responses to their RFI, and I'll go ahead and put that in the chat if Sarah didn't already.
Thank you so much. And I couldn't see exactly which of you was talking, but I really do appreciate you giving that update and for flagging it in the chat. The next is Laura Evans from Vibrant on the line as well?
Yes, I am. Thanks so much, Aisha. And I just wanted to thank Richard at SamHSA, Nashbita, as well as headquarters and our other crisis centers and other chat centers who are here. Did want to clarify, I know there was a question in the chat regarding Lifeline chat services. Lifeline chat services will continue. That is not something that needs FCC action, but falls within SamHSA jurisdiction. There have been, I know, a lot of updates that Steph and Hannah shared with us last week. I haven't tracked any new introductions, but we know states are in various processes of drafting. So we hopefully will see formally introduced legislation soon. Also wanted to flag that states are moving, in addition to Washington, on the Regulatory front, also seeing some regulatory action around crisis services from New York State as well. So would just really encourage folks, again, to connect with your state agencies, either around legislation and planning for the 988 transition, as well as the regulatory front. So very excited and wanted to, again, thank our chat centers that were the focus today.
Thank you so much, Laura. And I'm seeing that we are at time. So I apologize to Hannah and Steph, and also to Wayne, who had a couple of just minor things, but I would, I'm not sure who could do this, but if you can put in the chat, the NAMI 988 State Bill Tracking Dashboard, I think that's a fantastic resource that Hannah and Steph were going to talk about. And so try to get that to you. But next week, we have Dr. Madeline Gould talking about the Lifeline evaluation as the featured presentation. So that's November 10th. So that's where we'll be next. Thank you all so much. Thank you for the rich discussion. Thank you to all of the presenters, and have a good rest of your Wednesday.